Welcome to Counterpoint. I'm Tanya Granick-Allen. 1 year ago, the attention of the world was focused on COVID deaths. Several months later, surging COVID cases. And now it seems everyone is in a race against time to secure and administer COVID vaccines. And how is Canada faring in the global competition for vaccines? Apparently, not all that well, according to CNN, who just recently covered this very point. Take a look at this clip.
And Jake, look, this is a problem. You have to rewind decades to really get to the heart of this problem, but that doesn't let the Trudeau government off the hook. They've been in power for more than 5 years. They heard the dire predictions. This country for decades had a competitive advantage in making vaccines. The research was right here. But look, Canadians will now pay for that complacency. Trudeau promises that domestic manufacturing will ramp up next year. Jake, you and I both know it's just too late at this point in time. This third wave is punishing. I am speaking to doctors, especially in the hotspot of Toronto.
Some tough words, especially from our neighbors south of the border. But Canada is clearly lagging behind. We rank 47th in the world in terms of total number of doses administered, tied with Romania. Something I find of particular interest that is most interesting is that most of the required vaccines, or most of the vaccines require 2 doses administered, 1 month apart. But some Canadians who have received their first dose are concerned as now they have their second dose scheduled for as much as 4 months later. Even though many Canadians are eager to get a COVID vaccine, there are still a large percentage who are refusing. In some cases, 50% of frontline medical staff are simply saying no. And with recent concerns about blood clots with the AstraZeneca vaccine in some countries, and the pausing of the Johnson & Johnson vaccine in the US because of blood clots again, Canadians are hesitant to get the jab. And there still remains questions surrounding the COVID vaccine's testing, safety, and efficacy among scientists, research, doctors, and lay people. Well, later in the program, I will be joined by physician Dr. Stephen Malthouse of British Columbia to discuss some of these concerns with COVID vaccines. But now I'm joined by physician Dan Riley of Ontario, who will update us on how the vaccine rollout is faring and what Canadians can expect in the coming days with respect to their vaccines. Dr. Riley, thank you again so very much for joining me today. You're a physician in Ontario. We are locked down again. So many Canadians and Ontarians specifically are saying, where's our vaccines? How do we reopen this economy? Is the vaccine the path forward? So I guess I'll start with that question. Is the vaccine the path forward to getting us out of this COVID lockdown situation?
It certainly appears to be at the moment. When we look at the Ontario stats in the long-term care and the over 80 population, cases are actually way down. The vaccine seems to be working. And if we can spread that success to the whole population, then I think we can get ourselves back on track.
Well, that's good news to hear, because obviously LTCs were the COVID hotspots and they've experienced the greatest number of deaths, percentage-wise at least. So that would be great if we can finally get that situation under control. So as vaccines are now being rolled out, so in your opinion, how has Canada fared? We've heard some grim words from CNN just in my opener there. How do you feel we are faring in this race for vaccines in Canada?
So the rollout seems to be frustratingly slow. It seems to be that the federal government was slow to get vaccine into the country. Ontario is struggling to get it out into arms. The current stat is that about 80% of the vaccine that we've received, we've gotten into arms. It'd be much better if that was 95%. But it's slower than it could or should have been. And that's disappointing.
And I know that we're starting with the most at-risk population. So obviously with those 80 plus, and then they bring it down to 75 plus, now 70 plus. And I believe, I guess in Ontario, again, 1/3 of the Canadian population lives in Ontario. It's now, I believe, I think we're at 55 plus. Have I been too generous there?
So in most of the province, it's 55 plus. In hotspots in Toronto, they're trying to take it down to anybody over 18.
Okay. And where can people get these vaccines right now? It's no longer just happening in medical centers. I think you can even go to pharmacies now. Am I correct?
Yeah. Yep. So part of the challenge is there's a bit of a patchwork. So if you're 55 or older, you can use the provincial website to get either a vaccine center or a pharmacy appointment. The problem is in the hotspots in Toronto, it seems like you have to use a website related to that particular pop-up clinic. So it's a bit of a patchwork. But certainly if people have a family doctor or somebody they know in the medical system, give them a call and say, how do I access it? And can I access it yet?
Yes, and
but
even
if you're 55 or older, access the website and you've got an appointment.
And even in some of the hotspots in Toronto, in the Toronto community housing, some of the lower income housing, I know there were vaccines being administered door to door, even in some cases. So definitely, you're right, a patchwork system, and in some cases it's working well. In some cases, probably more room for improvement. We're going to pick this up right when we return. Welcome back. We're continuing our discussion on the COVID vaccines and their rollout here in Canada. And joining me again is Dr. Dan Riley here in Ontario. Dr. Riley, prior to commercial, we were discussing how ages 55 plus are really readily accessing the vaccines, obviously in certain COVID hotspots like certain areas in Toronto. They are being accessed by those 18 plus. So things are moving, but still we seem to have, we still seem not to have enough doses. And there's a concern there's going to be a gap now and that we require more doses. There's also concern now that the United States has pulled the Johnson & Johnson or hit pause on the Johnson & Johnson vaccines. And when we have the AstraZeneca vaccine, both for the same reason, because of concerns of blood clots, the AstraZeneca vaccine now is suggesting not to have it administered to those within a certain age group, or only, I think, 50 plus should get that vaccine. How serious is this concern about blood clots? Because, you know, for me, I'm in my 40s, I hear blood clots, I'm like, oh, wow, that sounds scary. Right. Should I be scared?
Yeah. So you shouldn't be scared. I mean, what I see when I hear all these stories is how well we're keeping an eye on things, how well we're keeping track of whether there's complications. It looks like the clot risk is incredibly small, probably 1 in a quarter million kind of risk. And the chance that your car is going to kill you this year is about 1 in 10,000. So it seems to be a real thing. It's an incredibly tiny thing. It tells me that our surveillance systems are working because we found this incredibly tiny risk. And for any particular individual, if you're not afraid to get in a car and drive around, then you shouldn't be afraid of the vaccine. Okay, now your car is 25 times less safe.
No, and that's a very interesting argument. And as you're saying it piqued my interest, or it brought it to mind another concern or another interesting component of that argument. So when the coronavirus outbreak started, and a lot of the first wave happened, and then the second wave, and of course now we are in the third wave. Some who are concerned about the lockdowns actually use the same argument, but for the opposite effect. They'll say, well, why should I get vaccinated for a virus that, I have a higher percentage chance of dying in a car accident than actually from this virus? Why should I even bother getting a vaccine? So how do you square that?
Well, so I think the risk of dying if you're young and healthy and you get this disease is incredibly small. That is true. The risk that you'll have a complication from the vaccine is much, much smaller. So if you're choosing door A, get COVID, or door B, get the vaccine, door B is much safer. And so that's definitely the way to go. And if you're worried about the safest path, then get the first vaccine that's offered when it's offered.
Right. Okay. And to your knowledge, is the AstraZeneca vaccine, you said it's just available for those 50 plus in Ontario, so it hasn't been pulled?
No, Canada. So what they've decided is that this incredibly tiny risk is probably most a concern in younger healthy patients, and also the risk from COVID. Balancing all that out, it makes sense to use that vaccine in the 55 plus.
Okay. So another thought that has come to mind, obviously my own, but others as well, is we keep hearing discussions of new variants, the UK variant, the South African variant, the Brazil variant. I'm probably missing some variant here, but there are several variants that seem to be coming. So, when I think about this, I say, well, hold on, if I get this vaccine now, will I require inoculation for another vaccine when they develop one for this new variant? How will the vaccine I get today help me against these new variants in the future?
Well, the vaccine you get today is protecting you against the variants that you're going to encounter tomorrow. Will it protect you against the variant of COVID you might encounter a year from now? That's hard to say. I get a flu shot every fall because we've developed a worldwide system to track variants of influenza and to keep us protected. So it may be that's where we're headed with COVID. But I don't worry in fall of 2019 that I'm not protected against influenza in 2023. I get the flu shot in 2019 for the variants of 2019. And that's what we do.
Right. And In your knowledge and your experience, have there been any successful studies to date that have shown, for example, that the vaccine has stopped transmission? Because this is another concern. People have said, well, just because you've had the vaccine, you may still have to wear a mask because you can still transmit the virus. There's been some discussion about this. Can you please, in the 30 seconds we have left, give us a little bit of information about this?
So that knowledge is developing, but certainly if our experience in long-term care homes in Ontario bears true for the rest of the population, the vaccine is preventing transmission.
Okay, well, so there's been some practical evidence is what you're suggesting.
Mm-hmm.
Okay,
Yep.
so in the 10 seconds we have left, do you have any last words for Canadians on vaccines?
The safest thing to do is get the first vaccine you're offered when you're offered.
Okay, well, thank you so much, Dr. Riley, for joining us again and sharing us your information here.
You're welcome.
We'll be right back. We're going to continue our discussion on COVID vaccines here in Canada, but I want to hear some of the concerns some physicians are having about this vaccine. And joining me now is physician Dr. Stephen Malthouse of British Columbia. Dr. Malthouse, we've had you on before several months ago, so thank you for joining us again. What are some of your concerns about these COVID vaccines? I recall last time we were discussing this new mRNA vaccine and your concerns with some of that. So should Canadians still have some concerns?
Oh, absolutely. This vaccine, was only trialed for about 2 months, and we're still in phase 3 trials now. So people don't realize that they're actually really guinea pigs for this. We won't know even the ingredients in those vaccines until the end of 2022, and for the Pfizer in the beginning of 2023. So, it's very hard to give informed consent to a medical procedure without knowing what the ingredients are of the substance that you're being injected with. So, just as a basic fact, it's very hard as a doctor to inform your patients if you really don't know what you're doing. So I think that people should be very, very concerned about this. And that's just the tip of the iceberg. There's so much more that should raise red flags for people.
Well, share with us what are some of the other concerns that you have? We have 4 minutes till our first commercial break.
Well, it's a messenger RNA shot. It's not really a true vaccine because it does not prevent contagion. So it can still be spread and you can still catch it. So if you think you're going to take off your mask or avoid having a passport or social distancing or lockdowns, forget it. It's not going to happen. And I don't think it's intended to happen. The shots were never designed to show a reduction in hospitalizations, ICU admissions, or deaths. It was only it was designed to show that there's a decrease in the number of people who have symptoms. And even that was pretty marginal. The adverse effects that people experienced from the vaccines were quite significant. 60% of people had grade 2 adverse effects. That means, enough to keep you in bed for the day or have to go see a doctor.
Right.
And those were not included in the trial results, at least the way they were reported. 95% efficacy is a complete manipulation of the statistics. The efficacy really, if you look at it, is probably more like 19 to 29% relative. And if you look at absolute, it's less than 1%. So
and
really,
and just to be clear, and that's the efficacy for reduction in symptoms.
That's exactly right, because they didn't measure the other more important outcomes.
Okay, well, the most important outcome I think Canadians are hoping, and I think this is why Canadians are lining up to get their jabs, is if I take, like you said, you suggest about masks, taking off your mask. So if I get this vaccine, does that mean I can get out of my lockdown? If I get this vaccine, can I now take off my mask? So I guess my question is, have there been any successful studies that have shown that these vaccines have stopped COVID transmission?
No, there haven't been.
So what's the point?
There is no point. If you have a mortality rate which is very minor, very similar to the annual influenza, then we have other ways of treating this. We don't need to go to a shot, and particularly a shot that has no evidence that it does anything to prevent passing this around to your loved ones. So you still won't be going to hug your grandparents with this. You still won't be taking off your mask. You're going to be back to the same old. And then, of course, there'll be fear mongering, which will bring in variants, and then they'll have another shot. And it's not just 1 or 2 shots. This is going to be every 6 to 12 months, maybe even more frequently.
Okay, and that brings up a good point. And I asked this to our earlier guest. I said, well, we keep hearing about these variants. Again, the Brazil variant, the South Africa variant, the UK variant. How effective do these vaccines that we have accessible today in Canada, which apparently we're not really accessible, that we're not accessing them that fast or that quickly, but for the vaccines that we do have here, the Pfizer, the Moderna, the AstraZeneca, will they protect against these new variants? Or I guess the question is, will they reduce the symptoms of these new variants, or do they not cover those at all?
First of all, I don't think we need to worry about the new variants. Dr. Michael Yeadon, who was a top scientist at Pfizer and was their vice president, is now retired. I mean, he analyzed all the data. He found that the chances of a genomic change is about 0.3%, whereas T cell memory and immunity can cover 30%. So we don't really need to worry about these variants. I think that is a boogeyman that's being drawn out so we can get more shots into people and scare them into the lines. Really, I think the variants, we kind of expected that, right? We do see variations in the genomic structure of viruses over time, and that is normal. It's as a virus adjusts to us, we adjust to it, and so we kind of become more, I would just say, in line with these viruses. We don't need to worry about them. I don't think that they're showing, and there's no evidence that they're actually more dangerous to us. A lot of it's done on modeling and some mouse studies.
Okay, because I did, and maybe we'll pick this up after the break, but I did see that Pfizer said that it will be putting out booster shots to update COVID vaccine annually, sort of like the flu shot. We know we get, there's a new flu shot offered every season based on some concoction of the one previously. So there's a concern I have here because the FDA in America said it will not require manufacturers to get reapproval since it's so similar to the existing one. I want to talk about what your concerns are with that right when we return from this commercial break. Welcome back. We're wrapping up our discussion on COVID vaccines here in Canada, and we're listening to Dr. Stephen Malthouse of British Columbia, who has some concerns with these vaccines and perhaps suggests we shouldn't be getting them at all. Before commercial break, I talked about Pfizer saying that they were going to need an update annually. If you're getting a COVID vaccine, Pfizer suggesting there will be a new one issued every year to kind of like a booster shot, if you will. The FDA in America said you're not going to need reapproval for that because it's so similar. That's kind of alarming because I know these vaccines, you know, I think it's universally acknowledged, they were kind of rushed through just to get them into people's arms. So there already has been kind of a very lax approval process. And now for any updates, there won't be any approval. That seems kind of strange to me. Am I off there, Dr. Malthouse?
Well, these shots themselves haven't been approved even yet by Health Canada. And, you know, I tell you, they would not have been approved even under an emergency situation if we looked at the data correctly. But the way we're able to roll them out is because we declared an emergency. And as long as we keep an emergency going, we don't actually have to put them through the typical rigorous trials that are necessary for a shot. And of course, you know, these aren't really even a vaccine. So of course, let's just think, what's the end point here? If you're a pharmaceutical company and it's to get as many shots into as many people as possible, I think that people must be suspicious if they're offering donuts to them every day after they've had their shot, or, you know, $5 to go and have a beer or something like that. Wouldn't you think that the pressure and the coercion that's trying to drive people to get these shots would make you suspicious? And you should be suspicious. I don't think these shots are safe by a long shot, and infertility is a high risk for these because of cross-reactivity to syncytin-1 proteins in the placenta. So I think that people who have these shots are going to be, my suspicion, and the evidence does not support this yet because we haven't had the animal studies that are significant enough or long enough to show this. But infertility, I think, is really on the horizon for people to get the shot. But
people have said this. I mean, this has been said. I think if you read through I think it's a 30-page Pfizer report, it does suggest that this not be given to women if they're planning on having children. I think they even put that in their own writing. Am I right?
Oh yeah, and actually, the CDC says that you can go ahead and give it to pregnant women, you know, as long as you think the benefits outweigh the risk. But, you know, most doctors really don't know anything about these shots, and they're not able to judge that.
So this is why it's important when we talk about informed consent. It's the person receiving the shot or the person soliciting the shot who's going to get it, rather. They need to have all the information. So I guess I would challenge my viewers in general, and I'll mention that in my closer, is that always get all your information, regardless of whatever medical process or whatever you ingest or take, intravenously. It's always important. So, you know, people need to be made aware of that. There's a doctor in British Columbia who has asked some questions of Dr. Bonnie Henry, Dr. Hoffe. He's asked some questions because he's been working with an Indigenous community administering vaccines. What were some of his concerns, and what did he see in that community, and why is he concerned?
Well, he's seeing a surprising number of people with neurological problems that have come back, including one person who died. Now, the person died a couple of weeks, I think it was 24 days after they had their shot, but their shortness of breath came on right after their shot, and they were telling their wife that they felt unwell. And one day they were sitting on the side of the bed and they just keeled over and they were dead. So we're seeing also that people are complaining of neurological problems, very much like what he thinks it has some similarities to multiple sclerosis, but people are having chronic pain, they're having numbness, tingling, they're having weakness, paralysis, People have had facial paralysis in a number of his patients. He's not actually giving the shots, but he's getting these reports when people come back from the clinics where they get the shots, and they're telling him, hey, by the way, since I had that shot, I haven't been able to open a jar with my hand because my hand doesn't work, or I've had facial drooping for the last 3 weeks. So he's seeing the results of those. He himself is not administering that shot.
So what is he asking of Bonnie Henry then, of Dr. Bonnie Henry, the Chief Medical Officer of Health for BC?
Well, he's saying that, is this what you expect? Is this what you accept? And if I see these adverse effects, how do I report them? Because they has a 9-page report that most doctors would take them about 30 minutes to fill out. They're not compensated for that, and I doubt that they even do it. Most doctors think vaccines are safe and effective. That's kind of the slogan. And when someone comes and says, look, I've got this facial paralysis, I say, well, it's not related to the shot. So doctors aren't even aware, and they don't have a level of suspicion which would allow them to even fill out those reports. So he's asking some pretty serious questions of Dr. Henry, and they need to be asked. But he's like one person, right? Where are all the other doctors?
So clearly there are quite a few concerns here with vaccines in Canada. We've heard quite a bit here. Dr. Malthouse, thank you so much for your time. We're going to hear from you again. We'll have you back on because I think there's going to be a lot of information coming forward in the next few months. So thank you very much.
Okay, thank you.
So lots of interesting information here, but at the remains of the day, my advice to you, which is not medical advice, is to always inform yourself before seeking out a medical treatment. You should always know what you're getting, what's in it, and what are the potential side effects. For Counterpoint, I'm Tanya Granick-Allen.